Wisconsin sees another spike in COVID-19 cases with the 7-day average at 17%. A month ago, that number was 8%. The Department of Health Services also reported its second highest total in new cases. The 2,300 new cases, second only to the 2,500 new cases reported less than a week ago. The state is also seeing a record number of hospitalizations with 528 current patients, and that's starting to put a strain on hospitals across the state. For now, southern Wisconsin hasn't seen the same increase, but hospitals are preparing. Andrew America has you covered on the situation right now and the plans in place to deal with what could come next.
More people than ever are right now fighting COVID-19 from hospital beds. UW Health's Dr. Jeff Potoff says it's because people aren't being careful enough.
I think they so much want to get back to normal that they're willing to take on more risk than what they were willing to take on before. And unfortunately, their risk calculations are coming up short and they're getting themselves infected.
Dr. Mark Coffin with Wisconsin Hospital Association says there's a strain on hospitals, particularly in the Fox Valley, Northeast, and North Central regions.
There is no doubt that we are in a significant near crunch time in a number of regions in the state.
Probably in those counties that maybe thought that they were going to be okay because they're smaller, they don't have as many people. Those types of decisions are probably leading to increased cases.
Even though hospitalizations haven't started to rise as much yet here, doctors say they are prepared, but only for so long. 82% of hospital beds in Wisconsin are full right now, but learning from last spring, hospitals have plans.
Here at UW Health, a really solid plan for how we will continue to try to create capacity, but all those plans have an endpoint. You cannot infinitely expand.
Dr. Kaufman says across the state, though, there's a staffing problem.
People who have close contact who are asymptomatic, including healthcare workers, have to take precautions in terms of isolation or quarantine. And that dynamic is really having an impact in the last week on hospitals' ability to staff.
All as flu season kicks into gear and hospitals ready for those patients as well. In Madison, Andrew America, 27 News.
Doctors say they don't expect hospitals to be drastically overwhelmed anytime soon, like we saw at the start of the pandemic in New York. But they are reminding people not to stop wearing masks, keeping a distance, and to get a flu shot.